Welcome to our channel Wisdom Tooth. Here we break down health related topics so that every person can understand. Today we are going to talk about black fungus. You must have heard about black fungus during the second wave of COVID-19. The word black fungus is actually a misnomer. So what do you mean by misnomer? Misnomer means it is a wrong or inaccurate name that is given. People are using the name just seeing the color of the lesion or the color of the disease process caused by the fungus on the skin. That would be black. We would learn why it is black in the subsequent time. The real name of this infection is mucormycosis. You must have also heard about the white fungus, the yellow fungus. These are all different fungal infections caused by different fungus. And just calling the fungi names seeing their color is not good. So from now on, let's call black fungus as mucormycosis. It is not a new disease. This has been a disease that has been infecting diabetic patients in the past. But why is it now infecting COVID-19 patients? Yes, we'll answer that also in this video itself. Now, let's see how does mucormycosis spread. The mucormycosis is caused by fungus like Rhizopus, Absidia, Mucor, Rhizomucor, and some more names are there, but these are the most common ones and they belong to the group Mucormycetes. This is a group of fungi. So this fungi exists in two morphological forms. That means they have two types of morphology. Morphology means different body shapes in their life cycle. They are the filamentous form and the spore form. So filamentous means just like what you imagine, the filament. Yes, they will have very delicate long structures called hyphae, right? So if you take the example of rhizopus, they will have hyphae like this. Many hyphae will be arranged like this. And from that, they will have a sporangia and a sporangiophore, and inside which they will have spores. So these hyphae are very delicate structure, but we do not get infection from the outside environment through hyphae. It is through spores. So we get infection by the inhalation of spores. Where are these spores present? They are mainly present in the soil, decaying vegetative matter, and dry leaves. In short, they are present all around us. They fly up along with the soil and dust, and we inhale it. There are also other rare modes of. So, what is the most common mode? Yes, it is inhalation. That means we will breathe in through our nose. Other rare modes of infection are ingestion. That means we will take it through our mouth, or if you have any cut on your skin, it can go in through that, but these are very rare. But why is this infection occurring in COVID-19 patients? Normally, the human body has amazing mechanisms to protect itself from the invasion of millions of bacteria, viruses, fungi, parasites, etc. that are present around us. So why in COVID-19? Under normal circumstances, it is difficult for pathogens to penetrate this defense system. But you must have noted in news that most mucormycosis occurs in COVID positive patients who have associated diabetes mellitus, and that too uncontrolled diabetes mellitus, that is, their sugar levels are not under control. In diabetic patients whose blood sugar levels are not under control, the immunity is compromised or decreased. How? There are several reasons for this. Several reasons. There is, let's see one by one. There is an impairment of cytokine production. Don't panic, I would say what is cytokine and what are its function in very simple terms. So, cytokines are small secreted proteins that are produced in the body that has many functions, and they are very important in the carrying out the immunity related functions in our body. They are required for immune system activation, and for, suppose there is one cell that is responsible for, there are many cells, suppose there is one cell that is there, and this cell will release certain cytokines, and they would signal to other cells to come, or like that. So signaling between different cells, and also recruitment of various cells to these areas to kill the pathogens. So when there is impaired cytokine production, these all processes, these signaling processes, these all are impaired. So they will have lower level of immunity. So some of the immune cells that you need to know are neutrophils, macrophages. So just know these two names, they would be helpful. For next one, let's talk about an analogy first. Suppose there is an issue in some part of our country, so more defense staff and soldiers would be recruited to that area. Similarly, in our body, when there is some problem in some part of the body, the leukocytes or WBCs, so the WBCs, these are the white blood cells that are the main group of immunity related cells in our body. These are cells that are responsible for defending our body. So these cells will be recruited to the area where there is a problem. But this recruitment process is also impaired in a person with uncontrolled diabetes mellitus with uncontrolled sugar levels. So now you have seen this, our immune cells, neutrophils and macrophages. So third is, these cells itself become dysfunctional. Various pathways in these cells gets dysfunctional. So the efficiency of these cells will also decrease. So third reason is dysfunction of these cells, dysfunction of neutrophils and macrophages. So these neutrophils and macrophages, so they would, if suppose this is a foreign body and this is a neutrophil, and this neutrophil will extend its arms like this, and they would engulf this foreign body inside this cell, and inside the cell they would kill this foreign body. That's what these neutrophil and macrophages usually does. So this process of engulfing is called phagocytosis. And so these cells are called phagocytes. So, and they kill them inside the cell, these killing mechanisms are also impaired. So at every level, of the immune activation, immune system, there is impairment in a diabetes mellitus patient. Do not think our immune mechanisms are this simple. They are way, way complex. I've just said the overview and the most simple way. In short, we can say that in a person with uncontrolled levels of sugar or uncontrolled hyperglycemia means the elevated sugar or the glucose level. Most of the defense mechanisms in the body is impaired. Associated with diabetes, there is a condition called diabetic ketoacidosis, DKA, diabetic ketoacidosis. In these, ketone bodies are formed in our body because of the metabolic derangements. And these ketone bodies, they provide a acidic environment inside the body of the patient. So this, in diabetes mellitus, there is a condition called DKA in which the patient will have an acidic environment in their body, and this acidic environment is favorable for fungal growth. So on one side there is hyperglycemia that is impairing all the immune functions, and on the other side there is this acidic environment that is caused by decay that is favoring the fungal growth. And this is why in a diabetes mellitus patient there is a increased chance for fungal growth than just normal me or you. And that too, in a diabetes mellitus patient, when there is uncontrolled hyperglycemia, when your sugar level is not under control, there is an increased chance. What are the other reasons why this infection has been increased in COVID-19 patients? You must have heard to control this hyperinflammatory state and the cytokine storm that occurs in the second phase, that is from after 8 to 10 days in the COVID-19 infection. In a patient with COVID-19, we use steroids in the treatment to control this hyperinflammatory state. It is a life-saving drug in that case, but steroids have certain side effects. So the steroid has a chance that it may increase your blood glucose, and it would decrease your immunity. So as a matter of fact, if a diabetic mellitus patient is undergoing steroid therapy, there will be a compounding effect and the patient will be more susceptible to mucormycosis. But steroid is a life-saving intervention that is given to COVID-19 patients to save their life. So there are also some report that COVID-19 infection decreases the T lymphocytes. These T lymphocytes are also WBCs. So these T lymphocytes are also WBCs, and that is white blood cells that are involved in the immune mechanisms, and these T lymphocytes are very much essential in fighting against fungi. So if there is decreased T lymphocytes because of the COVID-19, this can also increase the chance of infection. These are all hypotheses. These are all not hypotheses, but uh, researchers say these can be the reason. They are not 100% sure. So in COVID-19 patients, there is also increased iron levels in the blood because ferritin levels are increased. So just don't go deep into ferritin. Just know iron levels are increased in the COVID-19 patients. So all the organisms require iron. humans require, and so the microorganisms, all the microorganisms, fungi require iron for their growth and also for them to cause disease. So this increased iron level also provide a suitable environment for the fungi to grow. So certain drugs like desferrioxamine, that won't be used in a COVID-19 patient, but certain drugs like desferrioxamine, like they are also iron chelators. That is, they would bind all the iron in the blood, and they're used for certain therapeutic measures. But these drugs can also, because these drugs are segregating all the iron, the fungi can take the iron from these drugs, and that can also increase the chance of mucormycosis. But there are better alternative for these drugs, so nowadays those drugs are being used. And if so, in all these cases, we have been talking about a decreased immunity in the patient. So there are certain cases where a person may have decreased immunity. That is, if the person is having blood cancer like illnesses, the immune cells, the WBCs, will all be altered and they will have decreased immunity. And in organ transplant recipient, so those patients that have received organ transplants, they would be taking certain medicines to decrease their immune mechanisms, so that these immune mechanisms or these immune cells will not cause the rejection of their transplanted organ. So in such people who are organ transplant recipients taking immunosuppressive medications, they have a greater chance of infection. And some doctors I saw in the news pointing out that zinc tablets have a contributory role, but there is no evidence and all to support such thing. So we have talked about steroids, we have talked about iron tablets, zinc tablets. So this sums up to say that do not self-medicate yourself, because it's an art that doctors learn in medical college taking many years. So do not self-medicate. So why is this COVID? Why is this mucormycosis so dangerous? So it's a life-threatening infection. Most of us are familiar with that. The fungus most commonly enter through inhalation, through the nose, as I have said. So in the nose, in a normal person, the macrophages and neutrophils, which are some of the defense cells in the body, inactivate these spores in a normal person. But in an immunocompromised individuals, we have said due to many reasons this will not happen. The spores that we inhale will germinate. Just as a seed germinates, the spore will germinate. Once the spore germinate, what does it produce? It produces its second morphological form, that is the hyphae. This hyphae will be present in our body tissues and cells. Suppose, you know, to all parts of our body, the blood vessels are running and bringing blood. Suppose this is a blood vessel that is carrying the blood. This hyphae can invade into the blood vessel. That is, it can go into the blood vessel. This is called angioinvasion. Angio is related to the blood vessel and invasion. So when blood flows, it sees this foreign body, and when blood sees a foreign body, the platelets and the blood has a tendency to clot, and there will be endothelial damage also. So no need to go into the details. Just know that the blood has a tendency to clot. And so when the clot occludes the blood vessel, now the clot is occluding the blood vessel, now the blood cannot flow. So suppose there is some tissue here, this tissue is not getting the blood, this tissue is not getting the nutrition. So if this tissue is not getting the nutrients, that is the food that we eat reaches here, nutrition is required for the cells, and oxygen is also coming out through the cells. If it is not getting oxygen, if it is not getting nutrients, this cell would die. This cell would die by a process called necrosis. This necrosis is a process of cell death, and this cell death is responsible for the black coloration. So a lot of cells, not one cell, a lot of cells die, and there's this cell death is causing the black coloration or the blackish discoloration that is occurring, and that is called the black Eshhar. So inside the nose, so suppose this is the nose, this is your septum, and this is the other side. So this side of the nose has, when you go inside the nose, you can't see from the outside, but you cannot see from the outside. And when you go inside, there are openings of sinuses. So a fungal hyphae that is growing inside the nose can go into this sinuses, the same thing that causes sinusitis, and it can go into the sinuses. And in the sides of the nose there are two eyes, and this wall of the nose and this wall of the eye are related, and they are related by a thin bone, not this like thick area. It's a very thin paper like bone, and so it can go into the eye also. From the nose it has gone into the sinus. From the sinus it can come onto our cheek. So beneath our cheekbone, that is beneath our cheekbone, that is below the eye, beneath like our cheek area, beneath the cheek are sinuses. So through that it can come onto the skin, and it can go into the orbit like this. And this nose, above the nose you have the head, and sorry, above the nose you have the brain. Like there's a bone called cribriform plate here, no need to go like that, and above that there is brain. So through here the fungi can extend into the brain also. So there are other ways also by which it can go into the brain. So behind the eye there is a nerve that takes the impulses from the eye and goes to the brain, and through this route also it can go to, that is behind the eye. You cannot see in this diagram and just drawing, right? Or through the blood. So this hyphae I have shown in the blood, this hyphae can break in the blood, and they can go to different parts of our body. It can go to different organs of our body. So through different ways it can extend. So it can go into the orbit, it can go into the head, in the brain. Sorry, I'm repeating heads. Sorry, it's brain. So thus when it goes to the brain, it will cause abscesses, that is collection of pus in the brain. In the frontal lobe, that is the just beneath your forehead, there is the frontal lobe. In this frontal lobe it causes abscesses, and also it causes meningitis, that is the infection in the brain. And this fungi can also cause local destruction through this process, through cell death, and also by the enzymes that the fungi produces. And because of this rapid process of spreading of the disease, this can unfortunately cause death of the patient in 7 to 8 days if not treated. But there are treatments that are available if you diagnose the disease early and go. And this can also extend to the lung, cause respiratory distress. It can go rarely to the stomach, intestine, cause nausea, vomiting, stomach pain. It can cause discolorations of the skin that you have seen many pictures. And because these are all areas that we cannot see from outside. So for doctors to know what is the extent of disease in the patient, they may ask a CT scan or an MRI scan, so that they can know the extent of disease. And if it has extended to the eye, to prevent the extension to different parts of our body, they would have to do surgical debridement, surgically remove the infected tissue. You may have seen in newspapers that you may have to remove eye, you may lose vision. That is to save your life. So to plan for surgery and all, the doctors use may ask for CT scan, MRI scan, or to just to know the extent of the disease. Don't get panicky that they've asked the CT scan, now you have to go for surgery. No, nothing like that. So it can be for different reasons that they would know. So doctors will also take your sputum or something called bronchoalveolar lavage, that is from your respiratory tract. Secretions will be taken for looking for the fungus under the microscope and for other lab procedures. Now, Now I have said early diagnosis is important. So you are sitting at your home, you should know whether your relatives or someone or your friends or anyone, or you can say to, or you can educate someone what are the symptoms, what to watch out for. What to watch out for. So what are the symptoms? First, it is entering through the nose. It will cause early symptoms in the nose that you must note. That is nasal obstruction, nasal discharge, and blood from nose. So nasal obstruction is there, nasal discharge is there, blood from nose is there. These are all early symptoms and it needs early medical attention and you should consult a medical practitioner. What are the other symptoms? The other symptoms are headache, facial pain, blackish discoloration over nose or palate. There are other symptoms related to the eye pain, diplopia or double vision. There will be decreased vision, but these all can be late symptoms. There can be earlier eye pain, there can be redness in the eye, swelling anywhere in the face, in and around the swelling in around the eye. There can be tooth pain. Like if the lungs is getting involved, there can be coming of blood in the saliva, appearance of blood in the saliva. There can be breathlessness. There can be chest pain, and rarely your stomach or intestine may get involved. There can be abdominal pain, there can be nausea, there can be vomiting, and if your brain is getting involved, there will be drowsiness, there will be limb weakness, and if your skin is getting involved, there will be blackish discoloration, there will be small swellings called the papules and the pustules. So these are all symptoms. So if you have these common symptoms or any of the symptoms that I have mentioned, not like you are having, if you must be aware of these things so that you can help someone else for early detection and treatment. So now you must want to know what a person recovering from COVID-19 can do at home to avoid this infection. So this is pretty much important to know. So in this case, prevention is always better than cure. In any disease it is the thing, but especially in dangerous diseases like this, it is very much important. So if you are recovering from COVID-19, stay indoors. Especially if you are a diabetic patient or an immunosuppressed patient, stay indoors. I said these are mostly these spores that causes infection is mostly present in the soil, in the gardening area, in construction work area. There will be dust rising. Along with this dust, the spores can rise. So avoid gardening, construction areas, avoid working in soil, stay indoors if it is unavoidable, use masks, gloves, boots to protect yourselves. And regarding the use of masks, you can use N95 respirators when you go out of your home. Better stay indoors, but when you use it, cover your nose and mouth. You should cover your nose and mouth completely. Do not wear it as a beard over your jawline, right? You should cover your nose and mouth, and do not, it's It's better not to reuse, but in these resource limited situations, you may have to reuse. When you are reusing the cloth mask, you should wash, dry in the sun, and the cloth mask can be ironed and used. Strict control of blood sugar levels by regular exercise. That's very important. Diabetic mellitus patient can lead mostly a normal life if they exercise regularly, eat good diet, and keep their blood sugar under check. So you have to follow that and follow your physician's advice. Do not self-medicate with antablets. Do not self-medicate with steroids. Do not self-medicate with antibiotics. Don't ever self-medicate. And maintain oral and nasal hygiene. So you can use betadine mouthwash twice a day if you need. And if you are administering oxygen at home, the water that is used for humidification must be changed and it should be sterile. So never self-medicate. That is what I want to say again. Never self-medicate. And if you have any symptoms, even the slightest of the symptoms, always consult a physician. There are many phone-in services. You can go and consult. So consult a physician. So what about this white fungus and yellow fungus? They are just causing tantrums based on the name calling based on their color. So this white fungus is caused mostly by Candida albicans. And this can also cause invasive infection. Now you understood what do you mean by invasion. That means it will invade the blood vessels. This Candida infection in all cases will not cause invasive infection. It can just cause fungal infection in any part of your body that can treat it very simply by topical treatment. But certain cases like immunosuppression, they can cause this in angioinvasion. And the yellow fungus is caused by the Aspergillus flavus. Aspergillus flavus. So this can also cause angioinvasion. Mostly these infections are not much being reported in India. They are reported much more in Western countries than India. Hope that you have understood a very good amount about mucormycosis and you would use it in a very socially responsible way. If you have any doubts, comment in the comment section below.